Good morning, everyone. It's great to be here today. I am Captain Heather Damaris. I serve as the Director for the Office for the Advancement of Telehealth and the Health Resources and Services Administration. And before we officially begin the National Telehealth Conference today, I am excited to share with you pre-recorded remarks from a few congressional members. They wanted to share their thoughts about the importance of telehealth, as well as some of the work that they're doing in Congress to support this issue. First, you'll hear from Senator Tina Smith of Minnesota. She's a member of the Committee on Health, Education, Labor, and Pensions. Next, you'll hear from Representative Doris Matsui from California. Representative Matsui is a ranking member of the Subcommittee on Communications and Technology. And then the third set of remarks will be from Representative Carol Miller of West Virginia. And she is a member of the House of Committee on Ways and Means, and she's the lead of the Hospice Recertification Flexibility Act. Her remarks will highlight the importance of reaching rural and underserved populations through telehealth. Then we'll hear from Representative Buddy Carter of Georgia. He is a member of the House Energy and Commerce Committee, and he co-leads the Telehealth Modernization Act of 2024. Finally, we'll hear from Representative Mike Thompson of California, who is the co-chair and co-founder of the Bipartisan Telehealth Caucus. And now it is my pleasure to begin the video so that all of you can hear from a few of our members of Congress.
Hi, I'm U.S. Senator Tina Smith, and I want to say thank you to the Office for the Advancement of Telehealth and HRSA for inviting me to join you, and thanks to all of the leaders in this room who are advancing telemedicine. We share the value that all Americans should have access to quality, affordable health care no matter where they live. And as co-chair of the Rural Health Caucus, improving care in rural areas is one of my top priorities, and a big part of that means expanding access to telehealth. We know that it's often hard for people in small towns and rural communities to get access to health care. And I represent a state with a large rural population, and whenever I talk with farmers or visit small towns and rural places, physical and mental health care is a constant topic. Hospitals are closing, providers are retiring, and new ones aren't coming in to replace them, and our populations are skewing older and less mobile. During COVID, we made big advances in telehealth so that people can get the care that they need, and I want to keep that progress going. And we all know that this isn't just about physical health care, it's also about mental health. I start from the place that mental health and physical health are all part of the same issue. The brain and the body are connected. So telehealth means that patients can get the help that they need without the long commute to the nearest provider, or the stigma of being seen going in and out of a provider's office when they'd rather keep their healthcare needs private. I heard from a constituent for whom telemental health care was literally a lifesaver. Physical and mental illness can sometimes make getting out of bed or even getting out of the house just impossible. But by being able to talk to her mental health care provider on those days from home and not miss an appointment, then she couldn't make that appointment in person, well, it meant for her that she can get the care that she needs when she needs it the most. We need to protect those innovations in telehealth, and my bipartisan Telemental Health Care Access Act would ensure that patients can continue to receive virtual mental health care services, which we know work. I know that those closest to the work often know best what will work, and so I look forward to continuing our work together for communities across Minnesota and the country. Thank you for everything that you do. Take care and have a great conference.
Hi everyone. I'm excited to join today's National Telehealth Conference. I'd like to thank the Health Resources and Services Administration, HRSA, for hosting this important event and for inviting me to speak to you today. The work you all do, whether you are a provider, researcher, policymaker, or advocate, is so critical to moving the ball forward on telehealth. You are generating the evidence for telehealth and helping us to share its success. It's thanks to your work on the ground that we are able to advance meaningful telehealth policy. here in Congress. I'm proud to have been a part of the telehealth movement since the early days. Even in the past 5 years, telehealth has gone from a novel, unconventional tool to one of the premier modalities for treating patients. We can all agree that one of the silver linings of the pandemic was unlocking the incredible potential of telehealth. Now, we have the opportunity to maintain and build on this era of virtual care. Last month, the Energy and Commerce Committee advanced legislation extending telehealth flexibilities for 2 years. That was a good first step. But I know I'm not the only one who hoped we could go further to make telehealth a permanent part of our healthcare systems. The data doesn't lie. Patients and providers want telehealth visits. Telehealth improves access and provides high-quality care. And the evidence is especially clear when it comes to telemental health care. It makes perfect sense. When people are struggling mentally, it can be hard to even get out of bed, let alone bring yourself to an appointment. Telehealth has bridged the gap, allowing patients to pick up the phone and get help when they need it. That's why I lead the Telemental Healthcare Access Act to ensure telemental health services are available without burdensome in-person requirements. And I'm proud to co-lead the CONNECT Act that would make pandemic-era telehealth flexibilities permanent. So again, thank you for all your work to advance telehealth. I know that if we work together, we can truly transform our healthcare system. Thank you and enjoy the rest of the conference.
Hello, my name is Congresswoman Carol Miller, and I represent West Virginia's 1st Congressional District. I'm thrilled to have the opportunity to speak to you all at this virtual telehealth conference. I have often said that if anything good came out of COVID, it is the awareness of how critical telehealth is for patients in rural America to receive care. Coming from a rural district, I know how difficult finding care close to home can be and how stressful it can be to feel like you don't have the resources you need to be healthy. In West Virginia, it can take 5 hours for patients to get to the nearest hospital. Telehealth has done remarkable things for the healthcare industry. As a member of the Ways and Means Health Subcommittee, ensuring telehealth remains available for Americans is a high priority for me. A few months ago, my bill, the Hospice Recertification Flexibility Act, was included in a telehealth package which passed out of the Ways and Means Committee. This legislation will allow hospice providers to use telehealth to conduct the face-to-face visit required for hospice recertification after 180 days in hospice care. This provision keeps in line with existing hospice telehealth rules, and it makes sure that patients can remain in the comfort of their home at the end of their life. Telehealth relieves the burden of having to drive hours to a hospital when a patient is already suffering. The package this bill was a part of preserved many key telehealth flexibilities in Medicare through 2026 and passed through committee with full bipartisan support. It is refreshing to see members come together and agree on how important access to telehealth is to Americans. It's also critical that patients can access audio-only telehealth options in rural areas. Believe me, I know that, where they might not even have broadband capability for a video appointment. 91% of patients nationwide reported that telehealth made it easier to get the care that they needed. This is so encouraging. It's important to me that healthcare is accessible and available to everyone, whether they live in New York City or the Appalachian Mountains. We must ensure that this important flexibility is readily available to patients in the future, regardless of whether there's a pandemic or not. The Ways and Means Committee has done great work on telehealth, but there still is more work to be done. I want to work with all of you to promote telehealth and make sure that everyone, regardless of where they live, has access to quality health care. Thank you.
Hello everyone, I'm Congressman Buddy Carter and I have the honor and privilege of representing the 1st Congressional District of Georgia. I'm very lucky I get to represent my home. It's where I've lived my whole life and where I intend to live the rest of my life. The 1st Congressional District is also beautiful and it encompasses over 100 miles of pristine coastline, historic cities, and so much more. If you haven't had the chance to visit, I hope you will. I'm honored to have the opportunity to address you all today and discuss something that is extremely important to all of us, telehealth. As a pharmacist serving in Congress, my primary focus has been on healthcare and how we can improve the affordability, accessibility, and quality of healthcare for all Americans. Telehealth is an important tool in our tool chest to help patients connect with their healthcare professionals. During the COVID-19 pandemic, we learned just how important telehealth can be for Americans. I often say that we knew how important telehealth was before the pandemic, but we didn't quite realize it until the pandemic. Before the pandemic, we had a lot of regulations and red tape that piled up over the years. Once we removed these, we saw things like telehealth become extremely popular and effective. For those with chronic conditions such as diabetes, telehealth has become a lifeline. Without congressional action, these telehealth flexibilities will expire at the beginning of 2025, creating an access cliff for tens of millions of patients. Patients deserve better. That's why I've introduced bipartisan legislation that would extend these telehealth flexibilities for seniors. The Telehealth Modernization Act will preserve patients' access to telehealth, which will help patients, particularly seniors and those in rural areas, access timely, high-quality health care. The bill would preserve Medicare patients' access to telehealth through 2026, which is crucial for our seniors and those in rural and underserved communities. The bill extends audio-only coverage to help increase accessibility for those in rural communities with limited or no access to broadband services. It also extends the hospital at home telehealth program through 2029. It utilizes health centers and rural health clinics to provide telehealth and makes important program reforms. This is common sense, bipartisan legislation because increasing access to telehealth means increasing access to quality of care for patients. Our shared goal should be to promote solutions that help patients recover from their illnesses and manage their chronic conditions better, whether it's through a video call or an in-person care. It's also extremely beneficial for patients who live in rural areas far away from doctors and helps the elderly who may not have the ability to travel to a doctor. With the rise of anxiety and suicides, I'm especially interested in the advantages of telehealth to reach people who need mental health care. I think it would be a mistake to go back to the old way of doing things and end the expanded telehealth flexibilities. Millions of Americans have come to rely on telehealth, and our seniors deserve this. The Telehealth Modernization Act would help support their needs by making all of the telehealth flexibilities from the pandemic permanent. That brings me to my next point. You're uniquely positioned to provide advice and education to members of Congress. You have the opportunity to advocate for the issues you care about and the issues that impact patient access to care. Your opinion and your experience matter, and we need that expertise when making decisions about policies that will impact you. That's why I encourage people to get engaged and stay engaged with your representative. It makes a difference, and you can make a positive impact for your patients and your communities. Advocacy works, and it will have an impact. Once again, thank you for inviting me to address you today, and keep up the great work.
Thank you to all the attendees who are here today, and thank you to the Health Resources and Services Administration for the important work that you do. I've been working on telehealth for over 20 years. I wrote the first bill in the nation allowing for non-face-to-face reimbursement when I was in the California State Senate. And I've worked hard to make telehealth a permanent part of Medicare for a decade. As we all know, even though telehealth has been around for a while, it was COVID that really brought telemedicine to the forefront. When doctors couldn't run their practices normally and patients were advised to isolate, telehealth just made sense. It saves time, it saves money, and it saves lives. Not to mention, telehealth access is especially critical for Americans in rural areas, those with low mobility, and anyone else who otherwise can't easily make it to the doctor's office. As you all also know, we have a deadline coming up in December when current Medicare access to telehealth will expire. I'm continuing to push for as much permanent policy as possible. And fortunately, telehealth is a bright spot for bipartisanship. For as long as I've been working on this issue, I've worked with colleagues on both sides of the aisle to make sure we expand and maintain telehealth access for all Americans. I look forward to working with all of you and with my colleagues to expand and to make permanent telehealth access for Americans. Thanks again and enjoy the conference.
All right. Well, thank you to Senator Smith and all the representatives for sharing those messages with us about the importance of telehealth and all the work that they're doing to reach rural and underserved populations. Telehealth really is such a valuable tool, and that's why we're here today to talk about how it can improve the health of patients and improve access to care. So if you are just joining us, I realize we're a few minutes past 9:30, the official beginning of our National Telehealth Conference. My name is Heather Damaris, and I am honored to serve as the director for the Office for the Advancement of Telehealth at the Health Resources and Services Administration, which we call HRSA. This is our third annual National Telehealth Conference supported by the U.S. Department of Health and Human Services and HRSA. So we are here today, like I said, because telehealth continues to evolve, including the policies as well as all the knowledge we have gained, especially over recent years. HRSA's priority is really to understand much better how telehealth services are being integrated into care and to share best practices to increase access to care, also improving health outcomes and advancing health equity. And many of you have known about HRSA and the Office for the Advancement of Telehealth for a while now. But if you haven't heard of us before, HRSA has a long-standing commitment to telehealth with over 35 years of experience. And while the Office for the Advancement of Telehealth is home of this work, throughout HRSA, we actually work to increase access to telehealth services in a variety of different ways. HRSA has awards that use telehealth to strengthen healthcare workforce, support the provision of behavioral health and physical health services, and directly link patients in underserved communities to health services and resources. HRSA also supports grant awards to conduct clinically informed research in order to really build the evidence base for telehealth. And we track and we share the latest information about telehealth with providers, patients, and stakeholders through our website, telehealth.hhs.gov. And we also have regular announcements that we email out as well. So HRSA's Office for the Advancement of Telehealth serves across the department. We collaborate with key partners to expand and improve health outcomes through telehealth, and we continue to empower healthcare providers and patients to deliver and receive care using telehealth technology when it's the best fit for the patient and their health outcomes. So when we look back over the history of telehealth, we've learned that the expansion of telehealth over the past few years was transformative for most patients, myself included. I think many of us felt that over the last several years, particularly though those patients and individuals who are in areas with limited access to providers such as rural communities. So telehealth can help decrease the burden on patients to access care. For example, it can eliminate the need for a patient to travel or find childcare in order to go to an appointment. And according to the US Department of Health and Human Services report in 2023, telehealth use has consistently remained above 20% for all population groups. And so we do have significant changes in telehealth related policies that have continued the use of telehealth over the past few years, including the many telehealth policies that were put in place during the pandemic. So today, we look at the agenda for the conference. I am so excited to share that you all will hear more about the Centers for Medicare and Medicaid Services Medicare Physician Fee Schedule policy updates that are really important and can help improve access to care through telehealth services. It is promising that patients and providers have embraced telehealth and they want to keep integrating it into their overall healthcare alongside their in-person services. And so emerging technology presents tremendous opportunity to expand and integrate virtual capabilities to improve patient care, which includes areas such as monitoring, treating, and diagnosing. At HRSA, we continue to support telehealth to improve access to care for rural and underserved communities. It is something that all of us here today have the opportunity to work on together. So, as we get started, I again would like to thank you for joining us. It's an honor to have you with us today. And I know each of you are taking the time out of your busy days to focus on this, on the role that telehealth can have in healthcare delivery, and how to share the resources and best practices that we have with all of you, and then that you can also share with your colleagues. So, this conference has a lot of information, and if it piques your interest to learn more about telehealth events, funding opportunities, and research, you can also turn to telehealth.hhs.gov for more information. And like I said, there's going to be so much discussed here today. You're going to hear from a lot of federal leaders and telehealth experts on how telehealth services are being integrated. We are going to start off, I'm very excited to share with a session that the US Department of Health and Human Services has put together about increasing access to behavioral health, such an important topic. We will hear from the HHS Deputy Secretary Andrea Palm, as well as the HRSA Administrator Carol Johnson, and two HRSA grant recipients who are going to highlight key efforts on expanding access to behavioral health services and interstate licensure to expand access to behavioral health care using telehealth. So following that discussion, we're going to keep going. We're going to hear from leaders across healthcare sharing the great work that the organizations are doing to go beyond telehealth and improve access to underserved communities. We'll also keep pushing forward. We're going to have a busy morning. We're going to have our next session focus on ensuring access to telehealth for individuals with low income. And this will provide an overview of efforts to ensure equitable access to healthcare services through telehealth. You'll hear from a few of our HRSA grantees, Bay Rivers Telehealth Alliance, which is with the HRSA Rural Communities Opioid Response Program, and they're focused on medication-assisted treatment access. You'll also hear from the Jesse Trace Community Health System with the HRSA Optimizing Virtual Care Program, which is focused on remote patient monitoring, dental, and behavioral health work. And then finally, you'll hear from the University of Maryland with the HRSA Telehealth Network grant program, which is focusing on tele-emergency medical services. This is going to be a great panel. And when we wrap up with that, we will take a little lunch break, and you'll hear in the afternoon from leaders from across HHS and the federal government, including a variety of different government agencies within the US Department of Health and Human Services and across federal government, such as the Office of the National Coordinator for Health Information Technology, the National Institutes of Health, the Food and Drug Administration, the Office for Civil Rights, as well as the U.S. Department of Veterans Affairs. And they're all going to be sharing updates on healthcare innovations and telehealth. Then we'll shift over into a really important topic, I think, for a lot of healthcare systems and patients at this time, the evolving world of telehealth policy. This session is going to focus on a few highlights from HHS and CMS policy efforts to expand access to telehealth services, including a discussion about the most recent Medicare physician fee schedule that was released last week. And then we'll shift over to broadband. And again, this is the last session of the day, but a really important one because without access to broadband, you really can't have those quality video chats and telehealth appointments that are so important to do. And so during that session, we'll be focusing on improving access to telehealth and broadband services. And broadband experts are going to share their learnings from across the HRSA telehealth broadband pilot program. We're also going to hear about grassroots efforts in order to improve broadband access in Alaska. And we'll have an expert from the Federal Communications Commission, and they'll be sharing their latest initiatives and available resources. So telehealth just provides so many opportunities, and I'm excited to have all of the sessions today highlighting some of the ways and best practices we're using telehealth technology to improve access to care, and really to improve health outcomes as well. So the stakeholders and the federal colleagues here today really share your passion for telehealth and broadband. This conference reflects the interest and commitment of experts from across sectors joining together to really exchange the latest information on telehealth and share ideas to advance telehealth access for all. And the U.S. Department of Health and Human Services and HRSA will continue to work to promote telehealth services across the country. And while the integration of medical care that combines in-person and virtual services remains the new standard of care, many people call it the hybrid model, changes in policy and shifts in regulation and emerging technologies will keep evolving the state of telehealth. So telehealth really has been an effective way to improve access to care and advance health equity. We know that we will need to work together on issues such as broadband access and addressing social determinants of health in order to deliver care to people that need it the most. So I do hope you enjoy the sessions today. We are so excited to work with you to further telehealth. I encourage you to see the importance and the promise of this conference and telehealth, and to look for innovative ways to integrate telehealth to improve health outcomes for your patients and your communities. And I also want to acknowledge the staff from across HHS, especially within HRSA and the Office for the Advancement of Telehealth, for organizing this conference, our colleagues across the department as well as federal government for their participation in the conference, as well as our grantees across HRSA and specifically with the Telehealth Resource Center program for their assistance with speaking or moderating during some of the sessions today. And before I conclude, I want to make sure I cover a couple of housekeeping items that are really important. So there are just a few reminders here. The conference agenda, where you found this registration link and you found all of the Zoom links, it's all located on the conference website. So each of the sessions today will be hosted on Zoom. And to join each session, visit the agenda where you will see a hyperlink under each session title, and it'll say click here to join. So just go ahead and click on that little phrase under each session title, and you'll be able to connect to each of the sessions. We are recording each of the sessions today, and they'll be posted in the coming days. So if you miss one because you need to drop out for a minute and do some other business, that will be absolutely fine, because you'll be able to come back to it later. They'll all be on demand online. And now, I guess, since I took care of all the housekeeping items, I would like to transition to our first session. It is now my pleasure to direct your attention to our keynote session, Increasing Access to Behavioral Health. As I mentioned, HRSA Administrator Carol Johnson will be moderating the session with HHS Deputy Secretary Andrea Palm. They'll be joined by Brian Filson with the Association of Social Work Boards and Janet Orwig with the Association of State and Provincial Psychology Boards to talk about expanding access to behavioral health services and telehealth through interstate licensure. And so at this time, I would like to invite you to navigate to the agenda and select click here to join under the session title, Increasing Access to Behavioral Health. And thank you again. We hope you enjoy the conference, and I will talk to you again at the closing. Enjoy your morning.